Welcome everyone to the Ask Dr. Khan show. This is episode 143, and on this show, you're just one whiteboard away from solving your health puzzle. Now, you've been hearing about the brain-immune-gut axis in the past few episodes. So today we're going to talk about strategies to support the brain-immune-gut axis. How can you heal problems in the brain-immune-gut axis? Now, brain-immune-gut axis problem is very common. Usually, brain-immune-gut axis problem shows up neurologically as brain fog, fatigue. Keep in mind that fatigue is a brain symptom. You experience fatigue in your brain, right? Not in your bicep, not in your gluteus maximus. You experience fatigue in your brain. So if you have fatigue, you got to just say, I have a brain symptom, because that's what it is. So brain fog, fatigue, lack of concentration. You may have short-term memory loss where you walk into a room, you forget why you walk in there in the first place. You may have difficulty with words, hard to find the words, just at the tip of the tongue. You know the word, you just can't spit it out. That's called word loss. You may have trouble with depression or anxiety or lack of motivation or even just feeling like not yourself. So these are brain symptoms that's often associated with problem with the brain-immune-gut axis. Now, problem with the gut can show up as gut symptoms such as bloating, gas, even reflux heartburn if it's more upper GI. But typically, you're going to have food reactions or unpredictable food reactions where, one day you eat this food and you're fine. Another day you eat the same thing and you're not fine. You get reactions. So that can be very frustrating. So those are symptoms of leaky gut. However, many times symptoms of leaky gut does not happen in the gut. So a lot of times people say, well, my tummy doesn't hurt, so I can't have GI problem. That's absolutely not true. You can still have GI problems even though you don't have GI symptoms. So leaky gut can manifest as inflammation. You can feel like your joint is swollen and puffy. You can feel even brain symptoms because that gut-brain connection, when you have leaky gut, it may trigger brain inflammation. So now you feel brain foggy headache, can't concentrate, or drowsy after you eat. So that's a reaction, or that can be connected from leaky gut to leading to some type of brain issue. So those are the type of things that you want to look for. And it's very common. And for a lot of people, these brain-immune-gut reactions shows up as some type of autoimmune disease. In fact, dysfunction in the brain-immune-gut axis usually leads to autoimmune disease, such as thyroid problems, like hashimotos, such as lupus, such as rheumatoid arthritis, such as Sjogren's disease, such as people with some type of rash, like psoriasis. Now, eczema has been classified as an autoimmune disease. So if you have eczema, that may be an autoimmune condition in origin. There's 140 different named autoimmune disease. They're really all the same disease, just different manifestation of the same thing. And that same thing, that's the common denominator that can contribute to all these different types of autoimmune disease, be it rheumatoid arthritis or MS or lupus. It is really this dysfunction in the brain-immune-gut axis. So let's talk about how we can best support problem in the brain-immune-gut axis. So we have the brain, immune, and gut, okay? And together, I come up with a pretty nifty acronym, BIG, the big idea. The big idea is that the brain, the immune, and the gut is connected, and when you have dysfunction in one area, you're going to have dysfunction in the other, and it becomes a vicious cycle. That's why a lot of people have these chronic illnesses they can't overcome. They feel like they're frustrated and they feel hopeless because despite what they have done, they don't feel better. Either they've done the medical route or they've done the supplement route because nobody's really diving into how to untangle this web. And I'm going to show you how, okay? So problem with the brain can be due to blood-brain barrier issues. And this episode really is going to review a lot of concepts that I have mentioned in the past, but it gives you solid strategies to how to fix it. On this show, you're just one whiteboard away from solving your health puzzle, and I give you a lot of information to set that, that scientific background, right? You may be not a doctor. This may be information that's new or even technical for you. So I try to speak to you in English so that you get it, and I help you connect the dot. So know that the blood-brain barrier is that thin mesh of blood vessels that separates your brain from the rest of the body so that only certain size particle can get through to the brain. This is a protection mechanism, like a net that catches all the bad stuff and only lets certain things through. That blood-brain barrier can become damaged through concussion, head trauma, stress hormones, can be damaged through blood sugar, infections, toxicity, autoimmune issues. So there's a lot of things that can damage the blood-brain barrier. And when you damage the blood-brain barrier, and what happens is you're going to trigger these things called the microglia. Again, this is something that I talked about a lot on these shows. As a review, this is probably one of the most important things you can learn. You know, a lot of us, we learn about, oh, we have a heart and we have a thyroid gland, we have the gut-brain axis. We hear about these sexy things that you see a lot on internet articles, but you really probably have not heard much about the microglia unless you're a follower of my YouTube channel at Dr. Peter Khan or on my Facebook page. So the microglia are these support structure. They're these little cells. They're support cells. So here we have a neuron with its axons and dendrites that connects to another neuron. And so messages, nerve impulses are propagated from one neuron to another through what's called a synapse. Okay? So these are neurons, which means nerve cells. They're individual units of your nervous system, individual nerve cells, and they transmit message from one to another through this space called the synapse. Now in your brain, that's what your brain is made of, is a bunch of neurons, bunch of brain cells that come together, and that makes up the structure of your brain. But for every neuron that you have 10 of these microglia. So you have 10 glial cells. Maybe we should give it a different color. We have 10 of these. Let's pretend we have 10. And they all support this one neuron. In the past, we used to think that these microglial cells are like scaffolding. They're just kind of there as like the frames of the house to fill out the space, so then the neuron is what fills up in between the scaffolding. But now that we know that microglia is much more important than just scaffolding, they provide nutrient and also waste elimination. So they actually are like the feeders, they're like the babysitter that feed this baby, feed this neuron. But we now know that microglia serve very important immune functions. That these glial cells in your brain, they actually serve as immune function, meaning they're kind of like the white blood cell of your brain, right? In your body, you have white blood cell. When you have an infection, your body will dispatch more white blood cell to the site of infection or injury, and their job is to clean up the foreign invaders, clean up the bacteria and viruses, so to protect you. In your brain, the microglia kind of serve that purpose as well. And what happens is these glial cells, when they become activated, they trigger inflammation, or we call it neuroinflammation. Okay. So when they trigger inflammation in the brain, that's when you can have the brain fog. You can have the depression, slow mental speed, word loss, brain endurance issues, where you engage in some type of mental task, like you have to read a book or drive or take a test, then you crash afterwards. Your mental brain endurance is low. That's what happens when you have brain inflammation, essentially. And how many of you experience brain inflammation? Just put in the comment section, I have brain inflammation symptoms. Just put it in so you can see how many people struggle with the same thing. Now, the problem was that brain inflammation is a symptom that describes these things, but there's no official diagnosis for it. Meaning, if you go to your Western medical doctor, your conventionally trained medical doctor, they're looking for symptoms to treat. They're looking for a disease to medicate. And when you say you have slow mental speed, or you have brain fog, some of these have there's no drug for it. They have a drug for depression, antidepressant, but remember, when they give you antidepressant, they're not really asking you why you have depression in the first place. So they're not treating the root cause, they're just masking the symptom with the antidepressant, which can be addictive. And these other things don't even have a medical diagnosis, which means that there's no drug for it. So even if you complain of these symptoms to your doctor, they can't really prescribe something to make you feel better. This is the conundrum. This is where so many people are left in a gap. They want to feel great. They don't feel like they're themselves. There's this gap that they can't reach because the Western medicine is not trained to look at the root cause and use dietary, nutrition, lifestyle strategies to help you bridge that gap. And that's what we do in our practice. We help our clients overcome these chronic illness and chronically decreased function so that they can become their best self. And sometimes you're just one whiteboard away. You're just one information away. You're just working with us to help you identify that trigger or that root cause that's going to help you get your life back so you can start to function and start to live free of frustration and start to really feel empowered that you have control over your body. And that's really what people want. They want to feel like they're in control. But when you're stuck in this Western medical model where the doctor don't listen, they just prescribe a drug, they don't care about the root cause, you can really feel disempowered. You feel you don't have control over your body. And that can be frustrating and that can be scary. But once you understand where it's coming from, what the structures are involved, then you can reverse engineer it. And with our help, with the right tests, you can identify what's the root cause and be able to start to get your life back. So these symptoms have no medication for it other than depression, but even then, with the depression medication, it's not treating the root cause. So when you have activated microglia, so we call microglial activation, that's the medical term for it, that means that these structural cells, there's 10 for every one neuron, so really it's a 10-to-1 ratio of glia to brain cells. So that means your brain is more glia than brain cells. 50% of your brain mass is made of these microglial cells. That's just how important it is for brain function. And when they become activated, it triggers neuroinflammation, and this is the result: brain fog, memory issues, word loss, depression. And so many people suffer with this. So it's imperative that you share this information, that you share this video, and you learn this concept. You be able to speak to your doctor and speak to other people and say, perhaps there may be some glial problem. How do you know if you have microglial activation? Now, there's not a lab test for it currently. It's only done in university studies where they get a big grant. So in a commercially available lab, there's not a way to test glial activation. There is a way to test blood-brain barrier breach through a blood test to measure the structures of the blood-brain barrier if there's antibody against it. Or you can do what we call a GABA challenge by taking GABA, 1,000 milligrams, and see if you have any response. So again, this is what we do when we work with you to identify these things, but you can't really test that, so you have to understand how this works and what are the symptoms manifest. And most importantly, if you use the strategies to support this and you feel better, then you know that's what the problem is, okay? And we'll talk about the strategies in just a little bit. So that's the brain side. Now let's talk about the gut. In the gut side, when you have problem here, you have the intestinal lining, and the intestinal lining is one cell thick. Unlike your skin, which is multiple layers of skin cells, about 7 layers, the intestinal lining is one cell thick. That's it. So if it gets busted, what happens is undigested food protein can start to leak through this intestinal lining. And this is happening on a microscopic or cellular level. So you can't see it on endoscopy or colonoscopy. How do you detect leaky gut? There's blood tests that you can do that can measure if you have antibody against specific structures and protein found in the gut lining. That's how you find out. Again, when you work with us, we can order these tests for you. Again, if you say, well, I'm going to go to my medical doctor and ask them to do it because insurance will cover it. Number one, insurance won't cover it. Remember, insurance will only cover things that can be treated by medication. Perhaps depression. They'll give you a depression drug. Who cares what the depression is caused by? They don't care. They just want to sell you the drug. But that doesn't solve the problem entirely because you're not treating the root cause. So they won't do the test for leaky gut because there's no drug for leaky gut. The way you fix leaky gut is nutrition, diet, lifestyle, exercise. Just like, is there a drug for people who's out of shape? No, there's no drug for you being out of shape. You just got to go exercise. Being out of shape is not a disease, it's a state that you're in. And you got to take personal responsibility for that state and go out and exercise to fix that state. So being out of shape, there's no drug. Having leaky gut, there's no drug. So don't go ask your medical doctor, say, hey, can you run me a test to see if I'm out of shape and prescribe me a drug so I don't have to exercise and get in shape? You don't think like that with exercise. Why would you think that with this? Start taking responsibility. Start working with an expert that knows these things, that can connect the dot between the brain, immune, and gut, like myself, that can help you point you in the right direction. So if you have leaky gut, then what's going to happen is this is going to lead to the development, well, you can have actually LPS. This is called lipopolysaccharide. This is something that can be tested as well. And a lipopolysaccharide is a bacterial endotoxin that's very damaging to the gut lining, and that can actually cause leaky gut. And when it does leak into the system, it triggers massive inflammation. So this is where you may have gut infections that can contribute to leaky gut. Certainly, food sensitivity can cause leaky gut, such as gluten. And that's just one of many foods. Don't think it's just gluten. So if you just cut out gluten on its own, it's probably not enough, especially if you have chronic issues like thyroid problems, difficulty with weight loss, chronic fatigue, chronic depression. You feel like your brain's just not functioning, can't concentrate. You have hormonal challenges, adrenal issues, sleep problems. These are all possible problems with leaky gut that can be due to food sensitivity, and gluten is just one such culprit. You may need to cut out more. You also may have toxicities. You may have medication that can cause leaky gut. So these are things that can cause leaky gut. And once you have leaky gut, guess what? This can start to trigger a problem with your immune system. What is some of this problem? In the immune section, these problems will be inflammation. Now, how does inflammation come about? It starts with this cell called NF-kappa B. Now, if you haven't caught this episode, I have discussed this in detail in previous episodes. So go to my YouTube channel or previous Facebook posts of the Ask Dr. Khan show and look up the video on NF-kappa B or inflammation. But this is a nuclear transcriptive factor that triggers inflammation within the DNA. So it's a nuclear messenger, meaning it tells your cells to start an inflammatory response. Why would it do that? Well, inflammation is normal. If you are injured, it'd be normal to be inflamed. If you have an infection, it will be normal to be inflamed. Inflammation is not good or bad, it just is. It's just that when you have it for too much or too long, that's when it can cause damage. So NF-kappa B triggers this inflammatory response. In fact, it's called the final common pathway of inflammation response. All these different signals that trigger inflammation eventually all funnel through NF-kappa B, and NF-kappa B said, you know what, I've heard enough. I've seen enough. There's enough inflammatory signal in my environment, in my body, in my cells or injury, that I'm going to trigger an inflammatory response because that's the appropriate things to do to protect myself. And when it does, it's going to cause these T helper 1 cells and T helper 2 cells. And these T helper 1 and T helper 2 cells, one is like the killer cells and the other ones make antibody, and they balance each other out. These guys go out and kill the pathogen, and these guys remember the pathogen, so the next time when the pathogen come again, your body can respond faster. And this is all controlled. Think of this as a teeter-totter. The balance of this teeter-totter is your T helper 3 system, the T regulatory cells. Okay? And this cell is critical to controlling this so that your immune system doesn't tilt one way or the other too much to the point where you become autoimmune. This is the mechanism for autoimmunity, where you have this polarity where the T helper 1 and T helper 2 system becomes out of balance. This is what triggers your thyroid problem, Hashimoto. This is what triggers your joint pain. This is what triggers your MS or rheumatoid arthritis or lupus. Your autoimmune disease is caused by an imbalance within this. And the connection here is the gut dysfunction can trigger this, brain dysfunction can trigger this, and they cause each other. Down further, we have the T helper 17 system. And this is your nitric oxide. Remember the episode on the Nobel Prize winning gas, nitric oxide. And this is the gas. There's one specific type called the inducible nitric oxide, which triggers inflammation or damage. We should say tissue destruction. So this inducible nitric oxide triggers tissue destruction in people with autoimmune disease. We don't want that. So when we have brain dysfunction, which can be caused by microglial activation, you end up with neuroinflammation. This cascade of neuroinflammation not only leads to brain symptoms, it also triggers an immune response, which contributes to this NF-kappa B, nuclear transcriptase factor, causing a change in the cytokine polarity shift, causing loss of T regulatory cell function, which makes you lose self-tolerance. Self-tolerance is your body's ability to tolerate your own tissue, and that's why it leads to autoimmune, which then leads to tissue destruction through the inducible nitric oxide. Here, leaky gut caused by gut infection, food sensitivity, toxins, medication overuse can all trigger this immune response again, leading to the same result. And this can cause this. When you have leaky gut, it causes brain microglial activation. When you have microglial activation, it causes leaky gut, and all funnels through this inflammatory pathway. So there's your brain immune gut connection. And you're gonna see bits and pieces of these that I talk about in previous videos. So feel free to go back and connect the dots one whiteboard at a time. But I'm gonna focus the next few weeks on this microglia right here. I really want to bring awareness and consciousness to the public about microglia, so that you know this is an important structure in the brain, and it matters whether it's functioning properly or is out of balance or too activated, and what are the things you can do. So let's talk about strategy. Not gonna leave you hanging. So I'm gonna use green. Green is healing, okay? So if you see green on this board, it's the stuff that can help. So what can we do with these activated microglia, okay? This is where turmeric potency can be very helpful. Turmeric is a flavonoid compound that can actually cross the blood-brain barrier. See, not every compound can cross the blood-brain barrier. Turmeric can, and when it crosses the blood-brain barrier, it actually dampens microglial activation. It kind of put a damper on it, so it doesn't get activated as much. Okay, so decrease inflammation in the brain. We also can use things like Glutathione Synergy, which is an amazing product that contains 2 different types of glutathione and an N-acetylcysteine, all in a liposomal form for better absorption. And glutathione has the ability to dampen these whole inflammatory cascade that's triggering this brain inflammation. Lastly, Omega Pure Pro is important. Omega Pure Pro is your EPA DHA from fish oil. Now, it's important to know that fish oil contains different type of omega-3 fatty acid. One is called DHA, one is EPA. Research shows that the DHA is very important in brain health, while the EPA is more important for inflammation overall. Omega Pure Pro contains high amounts of DHA per serving, okay, in a molecular distilled form, so it's pure without any metals and toxins. So this is what we use to really, in high doses, to help support brain health, because your brain ultimately is made of 70% fat. So you need to give it healthy fat, and Omega Pure Pro is a source of healthy fat to support brain health. So on the gut side, this is where you want to use what's called a Neuro Metabolic gut repair program. Okay. So if you go to my website at askdrkhan.com/gut repair, I'm going to give you a free gift. You can download a free neurometabolic gut repair guide, which is designed specifically to help with the brain, immune, and gut axis dysfunction. So I'm giving you the tools. I'm giving you the recipe books, okay? How to do it. You just gotta follow it. It includes teach you what food to eat, what food to cut out. It's also going to make some supplement recommendations, things that I use in my practice to help people overcome leaky gut. And there's specific things. So there's a starter kit that can be found on our online dispensary, online store, that contains all the products that support gut health, help with absorption, decrease gut inflammation, and digestion. That's all included in this gut repair starter kit. You can find that. So I'm giving you the tools. You just got to use it, okay? So that's on this side. Now, as far as this inflammation piece, this is so important. There are things that we can do to dampen this NF-kappa B. And what that is going to be your turmeric. Your turmeric potency contains 3 different types of turmeric compound, curcumin compounds, okay, all in a fat-based source. So it's a gel cap with liquid in it. And this increases the absorption many times. And then on this side, the T regulatory cells, we need D3, vitamin D3 Pro 2000. The D3 Pro 2000, again, is a liquid vitamin D. Pill form, I find that, in my experience, does not absorb very well. Because I've run so many blood tests on people, pre and post, I find that liquid form in a D3 Pro uses an emulsified vitamin D to help with absorption. So usually in about 2 months, taking it at 10,000 IU per day, if you have a need for that, we can see the number increase by about 30 to 40 on blood tests, okay? The other thing that really helps with this is Glutathione Synergy. You're gonna see glutathione kind of in different places here because it's so useful for people with chronic inflammation, with chronic autoimmune issues. Glutathione also helps with leaky gut, by the way. So it's very versatile. You know, if there's one thing that I can recommend people take, it's Glutathione Synergy. The other thing that can help with this cycle here, you see this nitric oxide. So there's a product that we use called Nitric Synergy. And Nitric Synergy contains ingredients that dampen the bad nitric oxide gas, the inducible, but promote the 2 good ones, which are the endothelial and the neuronal. Okay, so those 2 promote brain function and promote circulation, while dampening the bad one, which causes tissue destruction. So help with circulation if you have cold hands, cold feet. Even people with neuropathy, a lot of times we find that they have poor circulation. So we use Nitric Synergy to help promote circulation. We also use this for people with any type of low blood pressure issues. If you have low blood pressure, if your blood pressure is too low, you might feel dizzy, lightheaded, feel weak, you get up too fast, you get dizzy. This can be really helpful. Okay, so here are all the tools. We have supplements, but it's not just about taking a pill, right? It's not just about taking a supplement. It's about changing your diet, lifestyle, nutrition, and that's by following this Neurometabolic Gut Repair Program, which I'm giving it to you as a free gift. If you don't already have it, if you've been watching me for a long time, you had downloaded in the past, good for you. Time to implement. How long do you need to do this for? Minimum 30 days. On average, 60 to 90 days, 2 to 3 months. So some people say, oh, I did it for like 2 weeks, I didn't help. You know, leaky gut can take some time. It's not a overnight cure. You know, if you exercise even, how long do you expect to see big muscles? You don't expect to see big muscle after only a week of exercise, right? You expect to wait, a couple of months or 3 months before you see, big muscle. That's why you P90X, 90 days, because it takes about 3 months for you to see significant change. So you got to stick with it. You got to follow the protocol, the eating plan, and you got to use the supplements where appropriate. Now, this is just for educational purposes only. This is not diagnosing or treating any conditions or disease. If you want to work with me one-on-one, please call 480-988-6269, where we can schedule a case review, and we can walk down the path. I can help you together, help you get on the road to start feeling better and solving your health puzzle. You can also email us at info@askdrkhan.com. And with that said, I want to thank you so much for watching. Please like this video. Please comment. I answer every comment myself personally. And please share this video with as many people as you can so that they can hear the message of wellness. Embedded in this, yes, we have the brain, immune, gut. We have symptoms. And it may seem frustrating. It may seem that there's hope is lost. But I'm going to tell you, these whiteboard presentations are going to change your life. If you really pay attention, if you connect the dot, you implement the information I give you, it will change your health. It will change your life. Please share this. And please continue to follow and like and subscribe on our Facebook page, Hope Integrative Wellness, and at our YouTube channel at Dr. Peter Khan. Thank you so much for watching, and I'll see you next week at the Ask Dr. Khan Show. Take care.